Good evening. Imagine you've been sick in the hospital. You still need medical care, but you're about to be discharged and you have nowhere to go. And the hospital tells you you can either go to a shelter or a group home, possibly even an illegal one. That is becoming a common story in this province. CityNews has done multiple investigations into group homes in this province. And tonight we bring you the story of a 73-year-old man who now finds himself in one, and he is desperate to get out.
This way, when I think of it, I can't help it. It hurts. It really hurts. And I can't complain.
He was rushed to hospital after a bad fall and put on a wait list for long-term care. We're protecting his identity because he is afraid he will be kicked out of the group home he is in. But we can tell you he has health issues and says he needs to use a wheelchair or walker. After close to 2 months in the Rouge Valley Hospital, he was told last Friday he had to leave. Except he had nowhere to go. He couldn't return to his brother's home because there are too many stairs, and the wait list for long-term care can be up to 5 years. The hospital, he says, didn't care.
But she said that I had to get out now, and I says, do I have time to phone somebody? No, get your stuff together, we'll help you put all your stuff together and get out. And I says, I can't, I ain't got no place to go. She says, you gotta go now. And she gets screaming at me, I gotta go now. And I says, I can't. And she says, well, we'll get the security guards in there. They phoned down to get the security guards. Two big security guards came. And they says, well, how am I gonna go out of here? We'll put you in your wheelchair and we'll roll you out the front.
He ended up in a group home with 7 other residents and is now living alone in a bedroom with 3 mattresses piled on top of each other on the floor. He says he can't leave because it is up 2 flights of stairs and there isn't enough heat, no nursing care, no cable, no blankets, and inadequate food. He is being charged $1,000 a month.
I feel like I'm here to die. This is it. In this room.
I'm sorry. And it was the hospital that suggested he go to the group home. He was given this list of group homes. At least one was illegal and has been shut down by Toronto Fire. It was mentioned in an OPP report in 2016 detailing appalling living conditions. Residents living on mattresses with mice feces and the smell of urine, inadequate food and medical care.
Hi, are you Winston Manning? Can I talk to you, please? It's Cynthia Mulligan from CityNews. Can I ask you some questions?
It was operated by Winston Manning, who recently pled guilty to multiple fire code violations in Toronto and was fined over $80,000. Now, the hospital would not specifically address the patient's allegations regarding his discharge, citing privacy concerns, but this is the list he was given by the hospital. On the top line, Little's Road is one of the illegal group homes that I covered extensively in my CityNews investigation, and one that the OPP also investigated and found residents were living there in appalling conditions. So I asked the hospital, why would they give this list with an illegal group home to a vulnerable patient? And this is the statement they gave me via email. We make every effort to ensure our patients have safe options available to them. We do not recommend, make referrals, or endorse any option in particular. We present the patient with information about every safe option to consider. Now, the Advocacy Centre for the Elderly tells me this is not an uncommon story. In fact, they say they receive calls from elderly patients every week who are about to be discharged.
You know, it's our position that hospitals should not be discharging patients who are waiting to go to long-term care into situations that are unsafe while they wait.
Hospitals are in a tough position, though. They need the beds, and the years-long wait for long-term care is putting incredible pressure on the healthcare system, a fact acknowledged today by the health minister. Is the lack of long-term care contributing to hallway medicine? I mean, it's all tied in together. Isn't there a massive gap in the healthcare system?
Yes, there is a problem with that in any given hospital. On any day, you might have between 15 to 25% of the inpatient beds are being occupied by alternate level of care patients.
Now, if you'd like to see our series on illegal group homes, go to citynews.ca. And a question, is it even legal for a hospital to discharge a patient who's on a long-term care waiting list? One expert tells me no. That's coming up. I'm also at Queen's Park, and earlier I was telling you about a 73-year-old man who was discharged from hospital with nowhere to go. Now he's on a wait list for long-term care, but there are 30,000 people ahead of him, and the wait could be up to 5 years. Now, the hospital told him he could go to a shelter, or they also gave him a list that has group homes on them, and the very top one is an illegal group home. Now, over the past year, City News has done many stories on illegal group homes outlining their appalling conditions. But experts say that discharging elderly patients with nowhere to go has become a growing problem. Can a hospital discharge a patient who is on a long-term care wait list and has nowhere to go?
No, and it happens all of the time. We know that hospitals are under terrible pressure to get people moving through. Hospitals are for acute care, but we have a huge backlog in terms of long-term care. And so it puts older people who are in really difficult situations in the middle of that crisis. And I've seen cases where police are called to escort people out, or I've seen ambulances dropping people off at homeless shelters. It's unconscionable.
The 73-year-old man says the hospital told him if he stayed, he would have to pay $1,700 or $1,800 a day. Is that legal, and is it ethical?
No and no. It's actually unconscionable. They can't charge him this amount of money, although it gets threatened across this province. We see it on a routine basis. They say, well, we're going to charge you something like $1,700 a day to stay. What they can charge is the amount of a co-payment of a long-term care facility, which is about $60, $61 a day. They can charge that. What we need, however, is a solution to not dumping people on the street with acute medical needs. What we need to know is we need places where people can be when they're waiting for long-term care, or we need more long-term care. Or if they can be discharged, we need robust home care. So sometimes people don't need to be in institutional care, but they need the services. They can't be left at home.
Now, this is a problem that grew under the Liberal government, who turned a blind eye to illegal group homes because they filled a gap in the healthcare system. Now it's the PC government's problem. Doug Ford campaigned on ending hallway medicine, and the lack of long-term care beds is a major contributor to the backlog in hallway medicine.